All right, ready? Yep. Hello. Hello, can everybody hear me? Hello, can you hear me? All right. All right. Hi, good evening, ladies and gentlemen. I'm Chuck Ramey. I'm the Chief of Public Affairs here at the VA Southern Nevada Healthcare System. I'd like to thank you for coming out and joining us this evening for our quarterly town hall. So we do these about once a quarter here at the Medical Center, and then we do one in Pahrump and one in Laughlin every year too as well. A lot of times we try to partner with our community partners and kind of do a themed event. So every January or early February, we kind of do a transition event. And then in the April-May timeframe, we kind of do a health and wellness event. But our community partners, our Veterans Community Engagement Board, they were doing an employment boot camp and hiring fair this month. So we've tried it with that in the past, but we felt like it just wasn't, the format wasn't working out of a timing because, you know, job fairs and things like that happen during the day. And we try to do these, if we're doing them during the week, we try to do them in the evening. So we kind of broke this off from that. So once a quarter, we do these here at the Medical Center. So what we do here at our town halls, if you have never been to our town halls here at the VA Southern Nevada Healthcare System, this is a moderated town hall. So what we'll do is our leaders are going to be providing some various updates from our veterans community on services and programs that we have here at the VA, as well as with the Nevada Department of Veterans Services. Following that, we will do what's called a moderated town hall format. And this is something that came from our veterans. So they wanted information and news. They wanted us to answer their questions. So a moderated town hall format is this, is like if you've got a comment or a question that you want the panel to address, Mr. Dave Martinez, where's David at? He's right here. Or Mr. John Scott over here. They have comment cards in their hands. If you just raise your hand, they will come to you. They'll bring you a comment card to fill out, and then they'll bring it up to us. If it's a matter of public interest or something we can address here, we will try and do that here in this format tonight. If it's a personal matter, we're not going to get into that. We're not going to talk about your personal issues or your personal medical items that are going on just due to patient privacy. So that won't be happening here, but we will have somebody getting back to you, and they have about a week to get back to you. If we're hoping that if we see some of that, Dave and John are pretty smart. If they see somebody that we might be able to help and walk out to talk to a specialist tonight, we'll try and do that as well. So like I said, moderated town hall format, all the questions kind of come to us via comment cards. So that's how we are. So let me introduce our panel to you real quick. Right here is our brand new director and CEO, Mr. Bill Karen. And for those of you who haven't or have been here before, he might look familiar. He used to be our associate director here a couple years ago. We're real happy to have him back. Off to my left-hand side is Dr. Ramu Kamandori, who is our chief of staff here at the VA Medical Center. Off to his left is Mr. Franco Fritz, who is our director of our regional office for the Veterans Benefits Administration. And Mr. Fritz, thanks for coming all the way down from Reno to join us this evening. We greatly appreciate that. And then on the end is Mr. Fred Wagger. He is the Deputy Director of Programs and Services for the Nevada Department of Veterans Affairs. I guess he didn't need an introduction. So Mr. Wagger, thanks for joining us as well. Obviously, we value our partnership with VBA as well as with the Nevada Department of Veterans Services. So we feel like this is a great venue to get all of our partners up here on stage to talk to you, because as we try to work issues together, we can all hear them and come up with group approaches to issues that might cross across our lines and all that. So I'm going to start it with Mr. Karen and let him kind of provide a VHA update. So Mr. Karen, sir, the floor is yours.
So as Chuck mentioned, I was here a few years ago as the associate director. Part of that, I worked in a small facility in Iron Mountain, Michigan, and I was the director in Tucson for about 2.5 years prior to coming back out here. Why did I come back to Las Vegas? Well, let me back up a little bit. I come from a family of veterans. My grandfather is a World War II veteran. My dad, a Vietnam era veteran. I was able to serve in the Naval Reserves while I was in school. I also went on active duty, was at Barksdale Air Force Base for a few years. Worked in the private sector for several years. I'm one of those physical therapy clinical guys that turned healthcare administrator as my career evolved. I really missed serving. That calling, that camaraderie, that value that I felt going home and looking at the mirror every morning was mostly rooted when I was on active duty. I didn't get that same sense of purpose in the private sector and came to VA about 9 years ago. Why did I come back to Las Vegas? Las Vegas is a unique city. It's a city like no other in the world, certainly no other in the United States. And what's very exciting about this city is there was no VA medical center, no hospital up until 2012. So we are only 7 years into our journey of standing up this VA Southern Nevada healthcare system. So to have the opportunity to do something great in a city as great as this, that's growing like this city, and this healthcare system, we are now 64,000 veterans strong that we are managing, is a tremendous opportunity, and I'm really blessed to be here. So let me give you a little bit of information where we're headed. So we'll start with some statistics. He's going to make me work with 2 hands. I don't know. We'll see how that goes. Yeah, flip. Good thing I'm not chewing gum. So I won't read to you, but look at the volume of veterans. Look at the volume of visits. Wait times, and we talk about access, that's a challenge. Why is that a challenge? We are growing. The city is growing, and I'm here to tell you that this challenge is not unique to this healthcare system. It's not unique to the city of Las Vegas. We are struggling with access across the country as a healthcare system, not only in VA. Now, that's not an excuse, that's just a reality. We've done a tremendous amount of work, and if you look at the average wait times and the number of volume of emergency department visits and the hospital admissions, everything is in this upward trajectory. So as much as we're drinking from the fire hose in some respect, we've gained some ground, and we're reaping the benefits of that. Next slide. So some of the accomplishments, CARF, similar to Joint Commission, those types of external surveys that we get, we've been very fortunate with our accreditations. Homelessness, right up there with suicide prevention as well as one of the priorities of our secretary. Homelessness, we've been working on this for quite a long time. So we have some nice trend lines there. As you can see, since 2011, the drop in veterans homelessness, and we achieved what's called functional zero some years ago, and we've maintained that. And functional zero means that we've identified every veteran who is homeless within our catchment area, and that veteran has been offered the appropriate level of service that he or she is entitled to, and housing certainly when appropriate. We're a leader in LGBTQ. We were recently recognized with some excellence awards, numerous quality measures. We also had, actually the briefing I came to before coming here was with Critical Management Solutions. They're a consultative group. When you're preparing for Joint Commission, we're always preparing survey readiness. And he had a very high compliment because he came out here a couple of years ago and he commented on how much progress we've made as a healthcare system, even with this tremendous growth and this trajectory that we've been on. So quality is one of those pillars of excellence that you never want to waver on, and you're constantly embracing those opportunities and trying to achieve excellence. That's one of the reasons we have these town halls, is we need to understand where our vulnerabilities are, our soft spots, our opportunities for improvement, where they lie. The Mission Act, many of you, I'm sure, have heard about the Mission Act, the new community care program. Some wrinkles in it. I will tell you that the rollout, for those that remember the Choice program some years ago, this rollout has been far more seamless than Choice ever was. We're still building the network, a lot of work to do yet. The urgent care network's improving. However, we're still struggling in those rural areas such as Pahrump and Laughlin. Here's some more information on Mission Act, non-emergent conditions. That's that urgent care benefit we were talking about. The criteria, that enrollment, do pay attention to that. You have to have been seen in the last 24 months and enrolled in VA healthcare. Some of the in-network sites, the website will link you because that network is evolving and expanding every day. So that's the website you want to use. There are some co-payments based on priority groups. Make note of that. Okay. Some of the activities that are going on, you might have seen the valet parking contract or the different locations that we're using. I think that's a tremendous service for our veterans. Some of the expansion, we're growing. Remember that conversation. We are growing, so adding acute beds, even with the volume of inpatient beds that we have in this hospital and with the military medical center, we still will be outsourcing 70 to 100 inpatient beds in the community at the same time. That's just to give you a sense for the volume of inpatient care that needs to be provided. We have the opening of the PRRT coming up. It's an inpatient program, residential treatment program for recovery from mental illness, substance abuse, PTSD. We're very excited for that. I think that's a great service that we'll be able to provide for veterans. For design, I was talking to a gentleman out back there earlier. How are we growing? We've got some property and we have the ability to grow up, a little bit of ability to spread. 2 new buildings, Women's Health Center dedicated to women, and then primary care building, which is needed because we are busting at the seams in many of our community clinics, as many of you probably know. Redesign of hospital information desks. There'll be some traffic closure coming through this main hallway, but it'll create much better flow for us in the future. Okay. So for me, the challenge in any healthcare system, any medical center, it's not unique to Las Vegas, is we have Congress. We have the President of the United States, we have Congress, we have VA, big VA, and big VA breaks out into National Cemetery, of course, the benefits side, which we have represented here, and the healthcare side. Priorities shift, entitlements change as directed by Congress, budgets, appropriations, things of that nature, they move and they shift. But we're a healthcare system first and foremost, right? So I have to be able to strategically align us and make sure that we are always hitting on all cylinders and constantly striving to improve so that we're aligned appropriately with the secretary, the undersecretary, our network, so on and so forth. So these 6 domains of excellence are typical in a healthcare system. So everything that we do will cascade and roll through these domains. That experience, we recently hired a veteran experience officer. There are times, despite the best of efforts, where we fail. And you experience something that doesn't feel right to you, and you're going to want to know why. We need to get better at communicating the why, get better at apologizing if you had a poor experience, acknowledge that, apologize for it, and tell you, what are we going to do about it? That's the action stage. And then follow up, follow through. Very disturbing when I hear from our veterans and they say they've called and they can't get through. I know our call center finally is got much better call responsiveness through the call center, but we still struggle in some of those clinic areas, like when you get connected to the clinic. We're going to work on that. It needs to happen. If you send a letter here, whether you go through the White House hotline, the congressionals, any of the lanes of avenues, what is the root cause? You had a poor experience and you want to be heard. You want to know what's going to be done about it, and then we need to close the loop on it, right? So it doesn't matter which lane you take. So I would advocate that if we strengthen our advocacy program on the patient advocate side, strengthen our veteran experience program as a whole, and I make sure that we have processes in place that we answer the doggone phone, number one, right? We respond to letters in a timely manner. We apologize when we've created a poor experience, and then we tell you what we're going to do in the future to try and shore it up. Does that mean I can fix everything? No. I'm not in Congress. I can't change laws. I can't change your entitlements. I can't change your benefit package. That is way above my pay grade. But I can work on the experience that you have here, because guess what? Under Mission Act, you have more choices than you've ever had before, correct? I need to earn that next visit with you, because if you stop coming to this VA and you're so disenchanted with this VA, I'm out of business, right? Yeah. I'd like to be relevant. We can be relevant because most veterans, despite our shortcomings, love their VA. Most veterans want this place to succeed, but I need your help for that. The domains, the experience, the access we touched on, that's important. You got to get timely care. It needs to prioritize and triage appropriately. Stewardship. I'm a taxpayer, believe it or not, as are you. We should be handling your money the right way. So providers need to be productive. Federal employees need to be producing work, right? Can't be hiding in closets, taking naps, those kinds of things, you know. And most of our staff, I would argue 99+% are really trying to do the right thing, and about 40% of our staff are veterans themselves. So majority of the time, we're trying to get it right. But stewards, we got to be good stewards of taxpayer money. Quality, we don't waver on this. We don't give up on this. We are always striving for improved quality. Safety, they go hand in hand. Staff need to be safe. You need to be safe when you're entering this facility or our clinics. And of course, community, that's us. We are partners. Next one. So where are we headed? In order to have a healthcare system, particularly in the world of VA, I need primary care and I need primary care access. And we've struggled with that. I need mental health care. We have the most robust mental health care system in the country in VA. Thankfully, with growth and with time, our mental health provider network of providers here locally is much stronger than it's been, stronger than it's ever been, frankly, which is tremendous. But we don't stop working. We don't take our foot off the gas. We actually have a hospital here, right? Inpatient care. What do you need to run a hospital? I need doctors, I need nurses, I need allied health professionals, I need people to take care of the floors and keep it clean and keep the infrastructure going. It's a 24/7, 365-day-a-year operation, right? I need a pharmacy, I need a lab, I need radiology, I need imaging. There's a lot that goes on in order to maintain an inpatient service. So foundational services means we need to make sure those are rounded out. That's our top priority when we business plan. Some unique services that you don't tend to see as much of in the private sector that is very much needed in VA, spinal cord injury, blind rehab, those types of, we've got a wonderful interventional pain clinic, some of the wraparound services, whole health, offering acupuncture and some of those complementary services. Those are types of things that VA can excel at. So we want to continue to create centers of excellence around there. 1A complexity, that probably makes no sense to a lot of people. We are growing. We are in a unique city with a unique population of veterans. We have infrastructure, we have acreage, we're relatively new. If we get the right people in the right place, we can be one of the most complex medical centers in this country, serving veterans every day. Research, academic affiliations, those are key components of being a highly complex facility. We're growing our research program currently and doing a ton more academic affiliation that's ever been done in our history. I mean, just a tremendous amount, both on the medical student side, as well as nursing, as well as the allied health. Community partnerships, that's why we're here today. We can't do this alone. The Mission Act, community care, when we can't provide what's right for you, we rely on the community. That doesn't mean we go away. That means we continue to grow, but we work together. How close of a relationship do we have with Nellis? Why is that critical? Because they have a hospital just like us. Veterans serving active duty serving veterans, doing the right thing for our brothers and sisters in arms. And that's what we do. And community partnership is very important to me. That's why this evening is very important to me. So I'm happy to be back. I haven't been here for been about 2.5 years. Blessed to be here, as I said, and we'll carry on with the town hall.
So yeah, so won't be tonight, but we did want to, one of our final slides here is we did want to let you know the save the date that we do have our Veterans Day barbecue and car show. That'll be here on November 9th. That'll be from 10 to 2:30 out here by our education center. So that's, speaking of community partnerships, that is a partnership with the Mason Service Organization. They provide all the food for that for free, and the cooks and that. It's a big service event for them. And I see Mr. John Issel in the back there. He is a big part of that, as long with Mr. Mike Clark. So John, thanks for your support of that event every year. And then we have our car show too with Las Vegas Cruising. That's another community partnership we have. And this is done under our voluntary service umbrella. So it's one of those great events we have. So we want you all to come out and be part of that if you can. So November 9th. So I guess the next thing I want to do is turn it over to Mr. Fritz to kind of let us know what's going on in our benefits side. Mr. Fritz, sir, do you need some help there? Yes. Here, we'll get you set up.
Just take this one.
There you go. You're set.
I got it. No?
Yeah.
There you go. Hi, okay, so I am the new Director of the Veterans Benefits Administration for the great state of Nevada. I just got here in April, so we're both kind of new. But I look, and my office is up in Reno, but I do, every chance I get, I come down here to serve veterans in Southern Nevada also, as we have a lot larger population, and I do have a satellite office down here. A little bit about me is I've served 22 years on active duty with the U.S. Army, hoorah, and then I've been working for the VBA for 20 years. So I'm all in for veterans. I do everything I can. I think right now is a really good time for the Veterans Benefits Administration. We have a lot of exciting things going on. You don't hear about backlog of claims or anything anymore. These days it takes about 90 days to do a claim from beginning to end, where it used to take 2 years. When I first got out of the Army and went and started working for the VA, my claim took 2 years to complete, and that was in the year 2000. So that's a big improvement. 2 years down to 90 days. So that's no longer a thing. We no longer have a backlog. It's at a functional zero, just like Mr. Karam was saying. We have certain amount that are over 125 days old, but most of our claims take about 90 days. Couple things that happened earlier this year. I'm sure that you've all heard about the Appeals Modernization Act that was passed in February of this year, and it's another process that is going to take all those old appeals. Sometimes some of you, I'm sure, were waiting 5 years to get an appeal. The way our system was set up, it wasn't right. So Congress passed the law on February 19th. And so now veterans, you can opt into the new process, even if you already have an appeal going on. And you have 3 different lanes you can go into. And there's a lot of good brochures back there on the table, the VBA table, about that, if you have questions on that. But all the old appeals that are currently in process will be finished and out of the system by July of next year. So everyone will be in the new system by then. So they've done about 6,500 claims under the new process right now, and they're also taking an average of about 90 days. So that's really good news. But the main thing I want to talk about right now is, anybody heard of the Blue Water Navy Act? Yes. Okay, good. So on June 15th, Blue Water Navy Act was passed by Congress, which gives presumptive service connection for Agent Orange for veterans that served in the Navy. And I noticed there's a lot of veterans that served in the Navy from the state of Nevada. But if you served within 12 nautical miles of say the territorial waters, is what they call the territorial waters of Vietnam, then you get those presumption. And some people were denied already because it wasn't into law, but this is a really good thing that we've done. It's just like back in 2000, when we first started with presumptive conditions, diabetes, heart conditions, lung cancer, all of those things that because of Agent Orange. Even my own dad served in Vietnam and died of lung cancer, and from the Agent Orange exposure. So, and for years, all these years, veterans that were in the Navy and were near Vietnam have been claiming the same type of conditions. So for me, it's about time that we granted this. The problem with it is the secretary has put a stay. Congress allowed the secretary to put a stay on processing these claims until January of 2020. The reason is because it's very complex, because 12 nautical miles just doesn't, you can't find out where a ship was. You have to look at the deck logs, and we're working with DOD. And 12 nautical miles off from territorial waters could be 3 miles off the shore, or it could be 100 miles off the shore. So it's complex. We have to look at the deck logs. And so we're working with Department of the Navy, and they are supplying all the deck logs to us. So we're getting What we're doing is we have teams, we're hiring extra personnel, and we're putting this all together so that it'll make the claims fast. As soon as a veteran comes in and says, I was 12 nautical miles, I have this condition, we can pinpoint that right out of their records, look at the deck log, look at and find out if it shows that they were within that 12 nautical miles, and then it'll be an easy service connection grant. Because I was a claims processor myself for years, and it can be very difficult trying to, find out, even though as a veteran, and I was in the same condition, same boat, is that I would say, no, I was there, but it's hard for the VBA to locate that in the records sometimes. So we're kind of trying to do the work up in front. So, but you can continue to put in claims for this. We just won't start processing them until January of 2020. Also, there have been some BVA, the Board of Veterans Appeals, has granted some of these claims, but it's only like 200 across the whole nation. But we're going to go ahead and process those. But now they won't be granting any more of those until January 2020. So anyway, that's about all I have as far as BVA updates. I'll probably be at all these town halls, and and come and see me and get a card from me. And if you have any questions, hopefully I'll have some tonight that I can answer for you. Thank you.
All right. Thank you, Mr. Fritz, and we do have plenty of questions for you this evening. Mr. Wagger, sir, would you please give us a state update?
Good evening. Good to have you here. And I appreciate the partnership that we have with the VA and working together. So first of all, a little bit about me. I'm an Army vet, 20-year retiree. I started out as a combat engineer and ended up being an interrogator. Don't ask me how that happened. First of all, on behalf of Director Cat Miller, appreciate the VA invitation to be here this evening. We have a great partnership with you, and we appreciate it. One of the things I want to mention real quick is legislation that passed this year here in the state. We did get our budget bill passed this year, and that included 2 brand new veteran service officers, one for Fallon, the other one out here in Pahrump. And so those are going to be full-time positions where they're part-time now. We have a young lady by the name of Brandy who goes out there 3 days a week now from this office, so it kind of takes away from this office. But that's going to become full-time, and that'll open up another spot here in this office in Las Vegas. So we're very excited about that. We also had another position that's actually a reclass. We had a women veterans coordinator that was an administrative 3 position, which is not a very high-paying job. That is now going to be veteran service officer as well, women veteran focus. So we're very, very excited about that. Speaking of women veterans, we are going to be having a women veterans conference in 2020. Just getting started on the details with that now. We're working with our women veteran stakeholders from across the state. More to come on that, but one of the major players is the Vice Chair of the Women Veterans Advisory Committee. Bobby Oates is here tonight. So Bobby, thank you for everything you've done. Talk to you a little bit about our 2 homes. We have the Southern Nevada Veterans Home in Boulder City. That's a 5-star rated facility by the Medicare, Medicaid folks, and so we're very proud of that. We just had a recent VA survey that was done in there as well. That went extremely well, so we're very happy about that. We have the Northern Cemetery, getting ahead of myself. The Northern Home, after Wendy Simmons is the other deputy director, so she's over the homes and I'm over the cemeteries, so we take care of you all the way through. I don't care what happens. But we have had a total of 16 move into that home so far. We just got that open and started moving in. We had to bring in 7 first, and then we had to go through surveys with Medicare, Medicaid, and VA. The survey that we did up there with the Medicare Medicaid study had absolutely zero deficiencies, and that's just unheard of. So we're very proud of that facility up there already. Now we have about 16 in there, and we're moving to 25. And then we have another survey by the Medicare, Medicaid, and VA facilities. They come in and make sure we're doing everything right. Then we have to go through the process of releasing 5 so they can see that we know how to do that. And then we build up to our final count of 96. And these are single bed rooms. It's just a beautiful facility up there. Their lunch, they can do it in their pod, in their area, in their neighborhood, or they can go to the main lunch facility and order off the menu, 12 items a day that they can order from. So steak and lobster, probably not. So the other thing that's interesting, and I don't know if the boss likes me bringing this up or not, but it's there, so I'm very excited about it. Because when I go up to Reno, you know where I'm going for lunch, but you got to sit with a resident, so that's fine with me. I'll sit with old veterans all day long. But the other thing they have is, or are going to have, they actually have it open, they just don't have alcohol, but they have a bar. And so when you move into the home, you don't die, you're moving into a place that can take care of you. And so that's going to have beer and wine. It doesn't have that yet, but every Friday now, they are having a Friday TGIF party with bands and the whole bit. So I mean, what a place to live. So isn't that great? Security? We got security. We have security. Don't worry. We've added security to the southern home, and we have learned lessons, and we have security up there too. So if you plan on coming in and drinking all night, it ain't going to happen. I do want to talk about our VSOs real quick, our veteran service officers. If you don't know, we have veteran service officers right around the corner. If you go through the VA benefits front door and go all the way back to the back, I've got 2 offices back there, and you can go back there. We do take walk-ins. If you need to make an appointment, we'll do that. But we do take walk-ins each and every day. I did that as soon as I came on board 2.5 years ago. I think it's important to see the veterans when they want to be seen, so we do that. We do some rural outreach by video now. We stole the idea from the VHA. Thank you very much. We have a program that's HIPAA compliant, and we can video chat with we have a Nevada veteran advocate, a volunteer that's out in Caliente. The city thinks she does a wonderful job for veterans, so they provided her an office once a week, and so we can do video and do claims by video at this point. Director Franco mentioned that we have they have the Blue Water vets, and I just wanted to mention something because a number of these Blue Water vets have passed away, and so if they have a spouse, I would encourage you to have them visit with our VSOs to make sure they get their claims in for benefits as well, dependent indemnity compensation or DIC benefits. So make sure you get to the spouses and let them know that. VSOs training, we are actually mandated by state statute to provide coordination with all veteran service organizations throughout the state. So if you are with one of those veteran service organizations and your chapter or post has a veteran service officer in your organization, we are providing free training in September 7th and 8th. If you have a veteran service officer in your post or chapter, please have them contact me, and we will get them headed in the right direction. This is absolutely free, and we're excited to present this, and the training is actually coming out of Washington, D.C., so these guys are really, really good. 7th and 8th of September. So please see me afterwards if you have any questions on that. We do have Nevada Veteran Advocate Training. I mentioned that. We have some NVAs in the room, and so appreciate you doing that. These are volunteers who come to our training, learn everything they can about veterans, and then pass the word on to their neighbors. So if you're interested in that, please come see me as well. That's going to be in November. One last thing, real quick, I wanted to mention our cemeteries. So the cemetery started in 1990, and so the Southern Cemetery, since its inception, has interred 43,692 veterans, spouses, and Gold Star parents. So we're very proud of the staff down there. In case you didn't know, and this isn't necessarily a good stat, but the Southern Cemetery in Boulder City is the second busiest state cemetery in the nation. So that's pretty impressive. Yeah. Good staff. Great staff. You're right. In June of 2019, they had 169 interments just that month. And so the Northern Cemetery, it's smaller, it's in Fernley. Of course, less population up there, but they've interred over 10,800. So very busy, great staff there as well. They do it with dignity and honor those that we inter. So I appreciate what they do. We do have an app, NDVS app. And if you're into apps, all you got to do is type NDVS for Nevada Department of Veteran Services, NDVS to 94502. And so if you have any questions for me on state benefits, those kind of things, please come see me after the after this, and I'll stick around and answer any questions you might have. Thank you.
Great. Thanks, Mr. Wagner. Appreciate it. So I just wanted to, before we go into the moderated town hall questions, I was a little remiss there. I kind of rushed us into the comments here from our leaders, but I did want to acknowledge a few other people that are in our audience tonight. First of all, I'd like to recognize from the office of Senator Cortez Masto, Ms. Alana Simpson is with us. Thank you for joining us, Alana. And then I'm not sure if he had to leave for another event, but we also had Mr. Terry Kerr from the office of Congresswoman Dina Titus, who is here this evening as well. So Terry, I don't know if he had to leave. I appreciate Terry coming out. Mr. Karen mentioned partnerships and community partnerships, and we are trying to. Former Governor Sandoval said he wanted Nevada to be the most friendly military and veterans-friendly state in the nation, and we've done that, I think. But our community partners make that, and one of our things we have here is our Southern Nevada Veterans Community Engagement Board, and our chairman, Ms. Nina Ridgway, is right back there. Nina, thanks for joining us this evening. We greatly appreciate it. And Bobby is jack of all trades here, as we say too. So Bobby's part of that as well as with the, and thanks for all you do for the Community Veterans Engagement Board, for our airmen at Nellis, and as well as for our women veterans too, especially all those great programs that you're helping run. So Bobby, thanks for being here as well. And then I'd also like to introduce some of our other leaders that are here with the VA Southern Nevada Healthcare System this evening. We have Dr. Commandeur here. I don't know if Dr. Alex Hassani, did he leave? Oh, okay. Dr. Alex Hassani, our Deputy Chief of Staff, was here earlier. We have Mr. Greg Wolf, who's our Acting Assistant Director, who's here this evening. Mr. Wolf, thanks for joining us. And I believe our rest of our staff is out working other things this evening. So just wanted to make sure I was not remiss in talking about those individuals. So as we talked before, this is a moderated town hall. So I have your questions, those that are emailed in, as well as the comment cards that were provided to us here this evening. I'm probably not going to take many more after this because I think we've got enough to keep us to the end of our time. But if you do want to fill out a comment card, please do. And please give it to John or Mr. Dave Martinez in the back. And what we will do is we will get if we don't answer your question here this evening, we will get you an answer. So we're going to try and get through as many of these possible. Some of them are kind of repeat themes, so I'm probably going to put like 2 or 3 of them together in some of these questions. So I think the one thing we want to talk about off the top, I think that Mr. Karen has this vision all the years I've known him is customer service. We've talked about that. Customer service is kind of the core of everything we do. And a lot of your questions from some of the people here, we're kind of talking about our customer service, where we're coming up short, where it's like maybe not being able to talk to a patient advocate, somebody not picking up a phone, not getting the answers they need in a timely manner, not being able to get connected. It sounded like answers. Mr. Karen, I guess what I would ask you is, so we can answer as many of those as possible, what are we going to try and do here at our facility to kind of improve those that customer service touch points and service?
So the first part is, as I mentioned, we got to answer the phone, and that's it's one thing to you never want to just chase a metric. So we measure everything in VA, average speed to answer and how many seconds this and that. The important thing is that we're reasonable in answering the phone, and particularly in getting that veteran one call resolution wherever possible. Now that's difficult to do because we're a complex healthcare system, but we got to pick up the phone. So our metrics look very, very good now as of recently, calling into the call center. That's tremendous, or calling into the pharmacy. Excellent. But then as I look at the data and spread it out, we start to fall short in some of those outlying clinics. So I actually had a conversation with the chief of administrative services today, and I said, look, you've been reporting on the call center and pharmacy, which is great, but you're in sustainment mode now. You got that. Let's work on the other areas. And I think that's how you just got to keep biting at that apple one bite at a time. So rounding out the call answering system is not just about call centers. It's about, if you're a veteran and you're in one of our clinics and you're face-to-face with one of our clerks, do you want that clerk picking up the phone when it's ringing while they're talking to you? Probably not. Or if a provider is having a conversation, those types of things. So it comes down to change the process and then round out with the right volume of people to be able to get those calls. And also have the ability for the calls to roll over to someone who can pick up that phone. So that's one of the strategies on the number one piece, the call piece. Now, sometimes you need more than a phone call, and that's where our patient advocates, which I think provide a good service, but if they're not able to respond in a timely manner, same concept, whether it's an email message, secure message, those types of things, or a phone call, then we've just created, you've already had a poor experience, you're going to the patient advocate, and we've precipitated that poor experience because we didn't close the loop and get back to you. So that's going to take a little bit of a drill down, and we're fortunate we've hired a veteran experience officer who's going to look at that. They've changed the software because we get White House hotline calls. We get congressional staffer routed through us. We get the patient advocate system. We get our SHEP surveys. We have we're very data rich, but that data has to be translated into information that's meaningful so we can figure out where our vulnerabilities are. And up until now, we had separate information portals for that. So now with the new PATS-R system, everything will go into there. So we can look at, geez, we're really struggling. Maybe the prosthetics area we thought was a great service to have a walk-in wheelchair clinic, but yet veterans are saying, well, why can't I schedule at some point? Those types of things. We have to see where the trends are in order to address them. So that's a couple things just off the top of my head.
If I can add one more thing, Bill, as Mr. Karen said, other thing we need is every employee to own what they do. This is critical. We are a mission-driven organization. You own what you do. And we have some VA has great people. We have some wonderful folks. And I can tell you, you have to do this. For my patients, I'll call them back. It may be Saturday afternoon at 3 o'clock, but I'll call them back. It may be 8 o'clock at night, I'll get them back. But everybody owns it. We have some wonderful docs. There's a doc back there, our associate chief for primary care, Dr. Monica. She absolutely owns her patients. I know if I want her as my doc, so not everybody go run up to her and make, but if I were a patient, I know for sure she'll get back to me because she's committed to owning it. But beyond Dr. Monica, the entire PAC team, you're 4 members of the PAC team, right? There's a doctor or a healthcare provider, a nurse practitioner, PA, right? Then there's a nurse, there's an LPN, and there's a MSA, clerical person. Those 4 people, I want them, this is what them look at. You have a panel of, let's say, 1,200 veterans. I want you to know every one of that panel. You want to know what you're doing, how you're taking care of them. You need to own your panel, but you need to own. If you work for this organization, you better be mission-driven or else pack your bags.
Yeah, times have changed.
Great.
Yeah, that messaging, and I think it's important. Thank you for bringing that up. Is own that moment. And I was talking to one of our veterans earlier, and he said, it's almost like, well, just go. It's like almost a laissez-faire attitude of, well, go to the patient advocate or call your congressman or congresswoman. That should be, you have that right. But as Dr. Kamanduri said, we need to own it. Because guess what happens when you call your congressman? it comes full circle back to that service. So we're trying to educate them and say, own this, be accountable. These are your veterans. These are our veterans. And our iCare values are ones of integrity, commitment, advocacy, respect, and excellence. So that sits squarely in our values. And as you said, we've said it's a new day here. We're going to raise the bar, and you need to be responded to. We got to close the loop.
All right, great. Thank you. Let's shift gears here a little bit and talk to Mr. Fritz over here. So, sir, we have quite a few benefits questions that have come in. One is in reference to Agent Orange. It's like the question is why, and this came from via email, is my question is, why do you claim to help veterans receive benefits they're legally entitled to, but it seems like that some of these processes are blocked? And apparently the background on this came from an Agent Orange person feels like they should get Agent Orange benefits. What can that veteran do to make sure that their claim is adjudicated properly?
Well, for Agent Orange presumptive, that's if you were exposed to Agent Orange, you need to have one of the disabilities first. One of the disabilities that the law, some of those ones that I talked about earlier, lung cancer. I don't have the whole list. I can get it for you, but it's lung cancer, diabetes, and all of the related issues to type 2 diabetes, heart conditions, Parkinson's. So there's a whole list, but you have to have one of those and we're exposed to Agent Orange. And, that's basically it. And then there is no barrier to receiving benefits if that is the case. But a lot of times over the years, many veterans come in and say, I was exposed to Agent Orange, but they really don't have a disability that they're saying that is a result of their exposure to Agent Orange. So I think that's where the confusion sometimes comes in, is because you can't be service connected for Agent Orange. You have to be service connected for type 2 diabetes, mellitus, due to exposure to Agent Orange in Vietnam, or it's in some places in Korea. So I think that's the basic, but I know that question. I've had that question all through my career. There's a little misunderstanding out there, maybe not in this room, but there is a misunderstanding about Agent Orange as a condition itself.
Just real quick, and he's absolutely right. You got to have one of the disabilities. In my past, I was a veteran service officer, and I'd have Vietnam veterans come in and they say, I want to file a claim for Agent Orange. I said, well, how many barrels do you want? You don't get a claim for Agent Orange, but there is that assumption out there sometimes that because you were exposed, you're entitled to compensation. And you do have to have one of the disabilities. I had the same question from Gulf War vets. I heard that I could get $100 a month because I served in the Gulf. No, you get compensation for disabilities. And so understand what the VBA is under. They have to follow the regulations. So the director is absolutely correct. You can't file a claim just because you were someplace. You actually have to have the disability.
Great, thank you. So this one, we'll switch back to VHA here real quick. The question, I'm going to kind of combine a couple of different questions in the interest of time. And this gets back, this is one I think we get on the healthcare side at every, like VBA gets Agent Orange questions we get to, is reference to dental. And this is a two-part question, and we'll give Dr. Kyle. So part one is it's kind of the question is like, why aren't all, and I'll finish, so give me part one and then part two, and then we'll let you answer. So part one is why are all veterans not, honorably discharged veterans not entitled to dental benefits and coverage? And then part two is for those who are entitled, why is there such a length in getting VA appointments for dental care here locally? It's kind of a two-part question, Dr. K.
The first part, the benefit side, that I don't know if I can even answer that, because I don't. It's based on congressional mandate and what the Secretary of the VA determines. Just like similarly, previous secretaries of the VA have said, look, and I have lots of friends who are veterans who said, why can't I come to the VA for my care? Well, I said, well, have no disability and you're a practicing doctor, you make too much money, I can't see you. They're like, but I want to come to the VA. I said, I'd love to have you at the VA. I'd love to take care of you. And the previous secretaries have said, over the many secretaries have said, look, there's more than 20 million veterans. We want to take all 20 million, but we need enough money to do it. And the Secretary of the VA determines the cutoff for the benefits side. So that's every year that he makes a decision what they're able to provide. So dental is a piece of, it's a very complex, difficult. I don't understand the benefit, certainly. I had one class on dentistry in medical school, and they said people have teeth, so that's about all I learned. So, but at any rate, so I don't know what exactly. So what I think go ahead and talk about the benefits.
Well, I can just add that for dental work, to be service connected for dental, you had to have had some sort of traumatic injury. Say if you had your teeth knocked out or a gunshot wound to your jaw or something of that nature. It has to be traumatic, not necessarily, periodontal disease or something like that. So that's all I had. Is that's where the benefit comes from, and that's why so many people cannot get treatment for it.
So that's why we don't have the control. But getting the access side of it, that's the important thing, the second thing. So with the Mission Act, now, one of the components of the Mission Act is obviously, for primary care, we have, and mental health, we have to get you in within 20 days, right? If we can't get you in 20 days, obviously, the veteran has a choice to leave the VA and go somewhere else. So like in primary care, the option right now, we're at 21.7 days. We're just on the edge. So, and we want to get below 20 because we want the veterans to choose us and come to the VA. Similarly, mental health. I'm just going to answer a bigger question of choice and coming in. So the other thing is for specialty care, like dental, it's 28 days, right? There's also driving times involved, 30 minutes for primary care, mental health, 60 minutes for specialty care if you're driving distance away. So those are other factors. So if you already have benefits, already eligible for dental, that part is solved. Now the question is, why is the length of wait? And that's been a real challenge. Some of it is, interestingly enough, it's not staffing with dentists is an issue, it's staffing with the hygienists, which were hard to keep at this VA. Local pay is very high for hygienists, so it's a struggle for that. But with the Mission Act, there will be a dental network in the community. So if we cannot get you in those 28 days for dental, now again, it's only the folks that already have the benefit will have access to get into dental care in the community.
Right. All right. Thanks, Dr. Comanduri. And I think, the big thing is for people to understand, it's you have to be 100% service connected, have an injury like Mr. Fritz said, or be part of a vocational rehab program. I think that's the third kind of tier for that as well. So, and I do know that Congress is kind of looking at this. If it makes you feel good, your local representation is. I know Alana is here. I know that her boss, Senator Cortez Masto, has kind of looked at this, is kind of researching it. So I think Congress is taking a look at it. We don't know what will happen in the future. They changed it just for retired military recently. Even retired military didn't have a real good dental benefit. And they just changed that to the same thing that the federal employees have. So who knows? There might be some other options out there in the future. So those are very good questions. And let's talk about the Mission Act a little bit. So we kind of have a two-part question, and part of this is VBA and part of this is VHA, and we'll answer the VHA question first. I think we talked about a lot of the different things that happened in the Mission Act, but one is that we saw with the Choice program was getting our veterans records, for their treatment records from outside. When we send somebody outside for care, or a veteran opts to go outside for care, getting their treatment records back into our system. Can you talk a little bit, Dr. Comanduri, about what we've changed with the Mission Act to make sure that happens?
So talk about the overall Mission Act. Certainly the veterans have more choices. All our veterans have great choice, which is positive. It's good news, veterans have choice. I think the other important part is, as Mr. Karen said, the VA has to step up its game. If the veterans walk out the door, there will not be a VA. We know that, right? We know for a fact, without the veterans, there will be no VA. So we have to do a better job and step up. So first, let me put the argument in for why choose VA. Why come to the VA? Why choose VA? If you can walk out the door, why choose VA? First thing, as I already mentioned, we're a mission-driven organization. So there is no question, this is a reason, one reason certainly to be here. The next thing, if you look at all of the quality data in every major study that's been done, every major medical journal, the VA quality is equal or better than the private sector. So the quality, it is not been shown, the quality is not inferior. It is equal and generally better than the private sector, right? The third thing is everything is coordinated and kept in the same system. So I'll give you a good example. In Nevada, we have trouble, obviously, recruiting specialists, especially subspecialists are hard to find. This is a state, I'm amazed. I went to medical school at UCLA. I lived in LA forever. I'm living here, and I'm thinking, we have a city of over 2 million people. You cannot even get a transplant. You need a heart transplant. No matter who you are, whether you're a veteran or a private citizen, what do you got to do? Go to McCarran Airport. Transplant, you have to leave the state. It's unbelievable. There are cities much smaller than us that have complex transplant centers that do liver transplant, heart transplants. When people come and see Las Vegas, it's like a desert for medicine. We can't be, just because we live in the desert doesn't mean medicine has to be in the same status. So we've got to get to a state that we have these things available quality. So it's harder to get folks, and eventually as the academic affiliates build up and get stronger and recruit folks, we'll do all of those things in Nevada. Certainly, that's where we want to get to. In the meantime, what are we trying to do? So just today, in fact, this afternoon, I spoke to the cardiac surgeons up in Palo Alto. I said, okay, they said, we want to figure out, you guys are a great referral site. You have great, wonderful veterans. We want to take care of them. I said, okay, this is what I want you to do. Number one, simplify your entire consult. Don't ask me to do 50,000 things before I send you a veteran, right? Number one, make it simple so we can send, because just like if I send you to the community, they're not going to ask me to do 5 other things, right? So we want to do that. So they said, okay. Second, do as much as you can the visit, either video or electronic some way, so that when the veteran comes up, it's a 1 visit experience or maybe 2 visits, so you don't make multiple trips. So we're going to try to come up with a way. The third thing I told them is this: you come down and see the veteran in person. To me, nothing beats having a direct contact with a human being, especially if they're going to operate on you. I want to shake their hand just to make sure, they're still a live person there, right? So I want to be able to do that. And then they said, okay, those are not unreasonable things. So we're going to work on ways to bring these complex surgeons. So you ask, why do we need to bring them down? Why don't I just go out in the community? Well, the advantage of this is this. This surgeon I talked to, she does complex TAVR surgeries. This is a surgeon who's both faculty member at Stanford University and Palo Alto VA. The 2 other surgeons with her, complex cardiologists, cardiology professionals, they're all academic researchers. Yesterday afternoon, I spoke to a young neurosurgeon. She's doing basic science lab research at Stanford and works at the VA. She's going to fly down in the next 2 weeks, begin to talk to us about how we can build this relationship. So for a veteran, we want the veteran to choose VA because we want to give you the highest quality of care. Maybe there's great care in the community. I'm sure there's good care in the community. There's no doubt. But if I want to get complex care, I want to get it from a top-notch academic system. In this case, we'll either be Stanford University, we're going to affiliate with UCLA, we are already affiliated with UCSD. We have an ENT surgeon from San Diego who comes up and sees veterans here. He's outstanding. He's a faculty member, he's a researcher at UCSD. He gives a level of ENT care that's just not available. So that's why we want our veterans. We want to keep things together. We're a mission-driven organization. We want to keep all your records, all your care together. And the third thing is we want to give you the highest quality of care with using high academic faculty. So that's why you should choose VA. But let's say you go out, you say, I don't want, if I'm not selling cars, and let's say if I'm asking you, if you say, despite all that, I want to go out in the community, right? Okay, how do we coordinate? First of all, the Mission Act gives us what's called the DST tool, Decision Support Tool. What it does is it allows for all the care. So when we refer you out into the community, and the tool is kind of funky. Good example. Just the other day, I referred somebody out into the community for nail care, to see a podiatrist to get their nails trimmed. In the authorization, it allows the podiatrist to order any labs they want. I don't know how much blood work you need before you get toenails clipped, but maybe you do. Then it allows the podiatrist to get a hold of an anesthesiologist. Now, if he needs to put you to sleep to cut your toenails, well, that's another complex issue. But it allows, the authorization is very complex. So when you go out with the DST tool, it allows for lab work in the community. So you can go, you see your outside doctor, they do the lab work. You can go to your local lab that the doctor works with. They will communicate back with them. You don't have to come back into the VA for lab work or x-rays or any of that. So it's all coordinated care. Now, our job, our community care folks, is to entirely coordinate everything that's occurring there, get it back into our medical record system. And that's our next step, is being able to coordinate with the outside providers. We are actually now scheduling with the providers in the community. So we schedule them, make sure the care occurs to our veterans, and then coordinate the records and pieces. It's not an easy thing to do. That's another reason why we ask veterans to choose VA.
That's not happening on the ground. I hate to tell you, it's longer to choose community than it would be.
Yeah. So from a record standpoint, now you won't go through a third-party administrator for us to get their records back. And then also something called VA Exchange is to leverage the health information exchanges that are present in various states. We need the Nevada Health Information Exchange to be partnered with, and most entities are already part of that. So that will facilitate and expedite the transference of notes. The Cerner system, of course, working with Department of Defense. I mean, those are all coming online. So those are things that are happening as time rolls on to better integrate those records.
All right, thank you. Mr. Fritz, I'm going to kind of ask a follow-on, and this is really, it's written down here with a Mission Act question, but it's probably a general question as well. Will VBA value medical opinions of outside providers, either people who are providing through the community care or others, for deciding benefits claims?
Well, the basic answer is yes. We have had trouble with that in the past. I admit, like I said, I was a claims processor for years, and we used the VA provider. When we sent a veteran to an exam, with the compensation and pension exam with the VBA, that's what we used. And if a veteran came in with an outside doctor opinion or something, we generally gave that less weight because we just had the exam at that time. But that's all changed now. We have what we called DBQs. What does that stand for? Somebody? Disability. Yeah. I say everything is initials, Yeah, an acronym. So yeah, DBQs, and so the doctors fill those out, and we give those equal weight. The rating specialists are taught, and our quality looks at that monthly on every regional office in the nation, and making sure that we are giving appropriate weight to outside doctors as the same as we do in VA doctors.
Great, thanks. And that was
I hope you see a change in that now, because it's been about 5 years since we started doing that.
great. We had a very similar question about that too, that said, could you please inform on if doctors, PAs, nurse practitioners can fill out the DBQ forms, those types of forms. So it sounds like you can do that.
Yes, absolutely.
Great.
Yes, at this VA? Because that was my question, that's what I'm asking. Yes,
Yeah.
at this VA?
Mhm.
Because
Yeah.
I've gone to many, and I'm getting different answers. No, we're not. We've been given a directive that we're not to do it. And so I'm very confused, and it's difficult because some doctors are, some doctors are not. They say it's our choice whether we want to or not. So it's a lot of confusion whether they can
Well,
or
I think-
not.
Yeah, for us, they go through.
Yeah, they go through comp and pin
They go
here
to
at the
comp and
VA.
pen.
Yeah, comp and
Through us.
Right. The DBQs are for the specialties and usually outside doctors, not VHA doctors.
Okay, and Nexus letters as same? Are VA doctors in here, they are or they are not to do Nexus letters?
They can. Yes, they do.
Yeah. Okay.
Yeah, that we do. I mean, I've written plenty of Nexus letters for veterans. I take care of them, do it. Yeah, a lot of people just are not good at necessarily writing the letters, and doctors are not notorious at writing 2-sentence letters, So, but yeah, I know they can do it, and we need to come up with a better way to do those Nexus letters. But yeah, we do. We write Nexus letters.
Right.
It's not the easiest thing. Yeah. But the DBQs, we go through the comp and pen in the VA system, but in the community, folks can do the DBQs. In fact, they send us a bill for filling out a DBQ. So.
Right.
Exactly, and for us as
Right.
veterans, we have to go to the community. They're charging a lot of money,
Right.
you know,
Yep.
to do those, so.
All right.
Or to balance it.
Great. All right, and Fred, this one's for you. You're the only state person up here, so I think obviously we just finished up with the Nevada legislature. The question is kind of what happened in the 2019 Nevada state legislature that vets and survivors might be interested in.
That survivors might be
It
interested.
says, it says veterans and survivors should
Okay.
know about or be interested.
There were about 20 bills passed regarding veterans in this legislature. I already mentioned the big one, which was the 2 VSOs and the reclass for the Women Veterans Coordinator to VSO. That was huge for us. We did get additional funding for our homes. One of the things we're looking at doing in the southern home is adult daycare, and so we have funds that where we can do a study on that now. So that's going to help veterans and their spouses who may need that kind of facility down here. I'm trying to think off the top of my head what veteran bills there were, but just an interesting one for your own edification for those who have Purple Hearts. A couple of things. One was I-11, the new corridor between here and Arizona, has been named the Purple Heart Highway. The other thing is for education purposes, anybody who received a Purple Heart and is going to go to school, all fees are waived, no books, no anything, they free. So that was a big one. There were some other education. We're trying very hard to improve the benefits for especially military spouses who come to Nevada. And so there was some bills passed. The reciprocation for if you have a license in one state and you come to Nevada to be able to do that. Some of that's in nursing, that kind of thing. The other one is a big one, and I'll give Barbara kudos on this one. Maybe you wrote the question. Barbara came to me after her husband passed away from complications due to Agent Orange, and they were not familiar with any of the Agent Orange benefits. And so she came to me after he passed away and told me, hey, you're not providing information at the cemeteries to the dependents of these Vietnam veterans. We're doing that because of her, but even more so, she got a bill through the legislature this year that said that we need to let every single civilian doctor in the state, medical facilities, know what benefits there are out there and encourage those medical facilities and doctors to refer those veterans to the VA benefits office to file claims. And so we are working on that. It's a big task, and so Barbara does not realize how much work she created. But thank you for everything you did. So we are continuing to work for veterans, and we'll do everything we can to meet the obligations of the legislative bills that passed.
Thanks, Fred. All right, so I'm going to try and get through as many more questions. We're kind of running short on time, but so we'll try and get these with as short as answers as we can, and then we will, if there's some more detail we have to follow back up on, we will. So I'm just going to kind of run through the stack here real quick. Dr. K, I'll give this one to you. I think I know the answer, but the question is does the VA do stem cell therapy? And if they don't, why don't they? And I think that's federal law.
Yeah, it's federal law. Stem cell, it's a complicated issue. It gets falls into kind of, I guess you could say, right to life. All of these things come together, and federally, stem cell is not a straightforward program. But certainly all of these are open in the future, but right now not available.
All right, great. So I'm going to go through here. Let's see here. So this question is and I apologize, I'm kind of deciphering some handwriting here. So I'm going to try and read this the best I can here. So if my appointments are sent outside the VA, some of my follow-ups are not being taken care of either by outside provider or the VA, sometimes in a timely manner. The delayed appointments for outside, and this is like dental, it's not followed up, or ortho. What can we do to maybe help make sure people are followed up on in a little more timely manner, especially when they go out for outside care?
Yeah, I mean, I think this is the one positive thing as the VA until recently, and that's been the problem, is like we didn't do the schedule, we didn't do the linking to the outside. So that was done by the third party. And I'm telling you, a lot of times third party says, oh, we called the veteran, we couldn't reach him, that's it. And then that's not the way to do it. So now the VA is taking over that. So which is a good thing. We will do a better job certainly better job than it's been done in the past, because we will take responsibility and we have better connection with our veterans. So that's one first step. With a follow-up with the new, especially with the dental piece, they don't have a network established yet. Once they have established network, then it'll have a clear basis of what the benefits are. They should be able to do the follow-ups and piece, because it allows the decision support tool that we fill out allows for follow-up visits, a number of follow-up visits, not all of them, but at least a couple. And then we can, if we need to do it, we do reauthorization. So that has been simplified. They've just not yet released or built their network.
Great. And I do think if you do have Mission Act questions, Mr. Karen was just asking that question too. Here's a good phone number for you. It's 702-791-9066. And some of the materials we've given you tonight, there's a Mission Act brochure in there, and that is directly to our community care. So if you do have a Mission Act question, you can reach out to those specialists specifically in that. Now, we did talk about phone calls and that. We are in the process of plussing up that staff. We're having, I think it's like 40 new people to work in there. So they're still plussing up. So, but we do have some experts in there that are well-versed in the Mission Act and community care that can help you with some of those questions. 702-791-9066. And it's in the materials we've handed out to you this evening. So that is that one. Okay, so the next one I want to talk about is pharmacy here real quick. And this is kind of a two-part question is, I guess, the question here, and I'm just going to get into several different pharmacy things, but I'm just going to hit on one here, is why can't a surgeon issue pain meds after release, I guess, for surgery? I guess that's kind of how the question is. And why can't a doctor prescribe additional meds, antibiotics for other issues or complications? I think we'll reach out to this person directly on that.
Just the opiate piece of it. Nevada has passed one of the strictest opiate prescribing rules in the entire nation. And that's created a lot of challenges. What's happening is veterans who are getting care outside the VA are now being told their praying doctors are just literally cutting them off. They're showing up at our door like, my doctor cut me off after like 5 years of treatment. That's not the way you manage treatment. Dr. Isani, our Deputy Chief of Staff, has created a great pain program, and we worked with veterans to take care of this. So prescribing opiates in Nevada has become very, very difficult. And a lot of doctors, subspecialists, other than the acute piece, don't really prescribe. So if it's a longer term, we have to go through the pain clinic program, and our program takes care of it that way. It has to be done differently because you have to check the state prescription. You have data bank, make sure nobody's getting meds from somewhere else. You have to do drug screens. You do all these now if you want to prescribe. The doctors in Nevada are lobbying to make the law a little more, I think, manageable. So maybe, I don't know if the legislature passed anything that are not.
Great. And thanks, Dr. K. And then a follow-on question, this was via email from another veteran, military retiree who gets care both at Nellis and here. The question was, is that, obviously with a military retiree, they can use some of their benefits to access the pharmacy at the military base and that, but it seems like they have difficulty with the VA giving them a script or whatever to go get their medications, which might be a little less than their VA copay at the military. Is there anything we can do to help any veterans in those situations?
Yeah, that one, I think it's possible to write a paper script that's taken over. I have done it in the past myself, given paper script for veterans to take out and get it filled. So it would have to be like a paper written script rather than using the VA. The challenge then is it won't go in the medical record. You literally have to add it on as a other medication kind of thing. Doesn't look like you're actually giving the medicine in the VA. Right. That's the challenge.
Okay, great. And so maybe that's one we can talk about with our Nellis partners about maybe figuring out something. So That's a good one. This one is from a retired Army Reserve veteran who retired after 32 years, obviously who has investigated, obviously our number one clinical priority, suicide, while they were deployed in that. And their question is kind of, despite the many resources being thrown out around this, it doesn't seem like, it seems like the rate is still holding steady, and they're wondering if the VA should do more to partner with the, various organizations, to include like the faith community, to help solve this problem. I think we have done some tremendous partnership. We might want to just mention a little bit of a partnership that we're doing, because obviously 14 of the 20 veterans estimated veterans who take their lives daily are not connected to VA care and services. You want to talk a little bit about that, Dr. Kate?
Yeah, and that's it's a horrific tragedy. Even like one suicide is horrible, and to imagine that 20 a day is just unacceptable. We know that. It's our top priority in the VA to prevent that, to see what we can do. And as Chuck said, most of the folks that have committed suicide are not connected to the VA in any way. We've got to figure out a way to do this. So some of the partnership we've done, there's a national mayor's challenge that's been established that the VA, along with the local community, is linking, asking local organizations when they come, are you a veteran? Is a question. Have you served in the military? These are the questions to ask to get folks to recognize and get them connected to the VA one way or another. So that's one. Also, the VA is offering, as you know, the benefit, at least some mental health services care for other than honorably discharged veterans. So that's a group that didn't have access before, now has some access to care. So to getting a hold of them, we do outreach to veterans in a lot of settings. We do a tremendous outreach to the jails and prison systems. And so working with areas where a veteran might be incarcerated, didn't even know that they had benefits or access to the VA. So we're doing other ways to do it, but it's clear. And our own suicide prevention group is excellent. One of the things they've done, which I think is a really neat thing, they've reached out to lease discount liquor, and they put in suicide prevention hotline numbers there, because we know a lot of folks will consume alcohol, and as I do it. They've also reached out to the gun range up on Decatur, and they work with the gun range, so have gun locks available, so that folks can at least think twice before reaching for a weapon. So there are things we're doing. Certainly, we need a lot more to do, organizing, connecting with faith-based organizations, connecting with the schools and universities. We have a lot of work to do, continue to address this issue.
Just to add on to that, he mentioned the mayor's challenge, and we have an individual from our staff that is very involved with that, and it does work. It's got a long way to go, as you said, but Nevada is the only state last year that actually decreased the amount of veteran suicide, not by much, but we're heading in the right direction. The other thing I want to mention is we are now involved with establishing the mayor's challenge in Truckee Meadows, Reno area, and also just last week she was in Winnemucca and Elko to spread that, and is going to be in Tonopah either next week or the week after. So we're working hard, and with all the partners, there's a lot of folks in the mayor's challenge involved with that. So the VA plays a very big part of that, and NDVS is trying to help that as much as we can.
Great, thanks.
Can I just add something to Matt? And you guys also have a link on your website that's dedicated to that and sharing information about
Veterans.nv.gov.
Right, and that, yeah.
Veterans.nv.gov.
Veterans.nv.gov is the website for Nevada Department of Veteran Services, and Ms. Ridgway is part of that Mayor's Challenge team. So Ms. Ridgway, thank you for that. So here's kind of another question real quick. It says, I believe that if we could get more information or heads up on some of the jobs as far as construction, casinos, and some of the factory jobs would help us as veterans. Obviously, I think we do a pretty good job of that, providing those resources. We had a veterans military fair here today that we widely broadcasted through our military career fair, through our Veterans Community Engagement Board and all of our VA and other partners. We had a boot camp here a couple weeks ago. I think the big thing to tell you is if you're thinking that you're not getting access to information, you can sign up for that through NDVS has a great calendar that they've started with their app and that on your calendar. Here at the VA, you can sign up for news and information with us as well. If you go to www.lasvegas.va.gov, you can put your email address in there and we will give you updates. Many of you probably got an email from us about the town hall. So we have about 53,000 enrolled veterans that are signed up for that service.
We do have the calendar. We'd love to have more people putting stuff on the calendar. It's just veterans.nv.gov and then click on calendar. We try to put as much as possible on there, but if you have something coming up that's of interest to veterans, please go sign up for the Nevada VetNet, which is part of the program. And you can put anything you want on there. If it's nasty, we'll take it off. But we do put the calendar. The other part is if you sign up for our app, again, NDVS at 94502, if you sign up for that, in the future, we'll be pushing things out there and we're not going to spam you. We just want you aware of veterans events coming up.
Great, thank you. I'm going to hit a few more here and then I'm going to kind of wrap it up. So this quick question, I think that we can all answer this is, what do I need to do if I have a medical emergency and need to be taken to a hospital? I think the thing is to call 911. If it's
Definitely, for medical emergencies, you saw the new urgent care benefit. Again, that is not an emergency benefit. Emergency benefits always been the same, right? This is not a change in this. For urgent care, for minor things, somebody's got a cough and they're like, well, do I really want to drive all the way up there? I can get care nearby with any of the urgent care centers, and that's great. So that's great benefit that's available to all our veterans that are enrolled. But for emergency, it's back to the traditional call 911, get to the nearest hospital. I mean, and that's a real challenge. We've seen, sadly, veterans that drove all the way from Arizona up here. And that's just not in a medical emergency. It's just not safe. I mean, what they should have done in some instances, we've seen, they should have gone to the nearest hospital there. They might have actually had to be flown up here. So it's important that we use the 911 system.
Yeah, and I think the other part of that too is if you do go to an outside emergency department and you are service connected and especially if you're being seen for a service connected activity, within 72 hours, you, the hospital or a family member should contact the VA so that we know that you're there so we can take care of managing that episode of care and working with those people. So.
I think the important thing also with the Mission Act, as more and more hospitals are finding out about this opportunity, they are like right on the spot trying to get hold of the VA to say, look, we have a veteran in here. So, but let the hospital know, get a hold of the VA, you call, get a hold of the VA just so that we address at least that key part of the benefit.
Great.
Something that the VA should actually push more because a lot of veterans really don't understand that they can go to outside community care without actually realizing they're going to get charged. A lot of them believe they're going to be charged for that, and that's a really big fear. So they'll take the drive all the way to the other side of town. So I think that should be something that we really communicate to veterans better.
Yes,
Right.
sir.
And yeah, thanks. And that is a good comment. And I know we've put out tons of materials on that to include videos and tons of communication, but we can hit that one again. So that's a very good point. So I'm going to kind of wrap it up here. We talked kind of some of the negative things in that right up at the beginning, but I want to talk a little bit and kind of close with some of the positive. And thank some of you for your comments here. So I'm going to read some of these just to kind of wrap us up and put us out on a good note. So I have been using Southern Nevada healthcare system since 1998. The improvements have been impressive. I feel I get exemplary care. The expansion of non-traditional medicine is impressive. But this hospital and the Southwest Clinic are the greatest. Everyone at both institutions treat me like royalty. Thank you. And then this one is, my comment is to thank the VA. I felt like I was broken with my soul, but the kindness and compassion I found, here was wonderful. I'm trying to paraphrase that, so I do apologize to the person for not reading all that, but thank you for your comment as well. So, and then there's a shout out to an individual here. Dr. Park is great at his job, so thank you, Dr. Park, for all the great work you do. I think we answered most of the ones we could here in a public forum. We will answer back if there's some that we didn't get to tonight. We'll get back to people one-on-one, but we did want to thank you for taking the time and coming to our town hall this evening. Fred, did you have one more thing?
I just want to make one announcement. So we've mentioned several times the Southern Nevada Veterans Community Engagement Board, which is part of the VA, but in particular, Nina Ridgway back here is the chair of that. They were nominated as Veteran Supporter of the Month. And so they were selected. And so next week on the 8th over at the Grant Sawyer Building at 10 o'clock in the morning, if you're available, please come by. The governor is going to be presenting that award to them. And so congratulations, Nina. Great job.
Yeah. All right. Wonderful. Well, that wraps up our town hall for this quarter. Our next one here at the Medical Center will probably be late October, early November. We haven't locked that date yet, but we do want to make sure that you do come out for our barbecue, and that is on November 9th. So please put that on your calendar, and we'll stay for a couple minutes if you have any one-on-one questions. But thank you for coming out, and thank you for your time this evening.
Thank you.